my tool. This is actually instrument assisted soft tissue mobilization, IASTM, or better known as Grafton technique. It is a beveled edge, and what we do is we go in and release the tension tissue that's in that knee that's not allowing Dr. Smith to get that full range of motion.
Hey guys, Dr. Eric Smith, and I'm in Miami again with Dr. Sam. If you saw some of our other videos, you know this amazing chiropractor has a great skill set. So today I'm going to have him work on something else outside of my spinal adjustment that hopefully you've seen that video. If you haven't, check it out. But I was doing some sprints and I injured my knee. So the top few things that people go to chiropractors for, first is their spine, next is usually shoulders, and then knees, believe it or not. So if you have knee issues, I highly suggest you check out a skilled chiropractor that works with those. So he's going to do a few things to start getting these muscles released, because typically knee issues are a lot to do with muscular issues around the knee. So if you take care of that and stabilize the knee, you shouldn't have many knee problems, because the knee works like the elbow. So it should really do this, and at the end range, so when you really extend your leg, if you try it, and if you haven't, want to do this, stand up right now, and when you lock your knee out, it's like the elbow. It does that last little lockout. So that's about the range of the motion that the knee should go, just like your elbow. So he's going to work on some things, and he's already assessed my knee, so I'll let him talk about what he's going to do to help fix my knee so I can stand up straighter and get back to training.
Fantastic. Thank you, guys. Dr. Smith, as he's saying before, he works on a lot of athletes. Myself, I specialize in sports rehabilitation, so I see a lot of knees, shoulders, elbows, wrists. In Dr. Smith's case, we actually assessed him already. We know that he injured in sprinting, as he said before, and it happens to be a little bit of adhesions and fascial tension, myofascial release of the popliteus, which is right behind the knee. So whenever, like he was saying, if you try to lock out that knee and you feel a little bit of pain, if you go from a seated to a standing position, these are the indications that you may have some knee trouble that we can get to earlier, so you cannot face that dreaded S word surgery later on. We want to get to these injuries fast and quick so we can avoid that. So Dr. Smith, go face down for me. Now what we're going to do is two-faceted approach to the knee trouble that Dr. Smith was having based on our assessment. First and foremost, I'm going to use my percussive massager here with Lots Fit, and we're going to release the musculature around the knee. Now we're going to go through the hamstring right here, feeling those knots, so to speak. And I know he feels it. Yeah. When there's imbalances of the musculature, this can lead to a lot of knee troubles. And a lot of medical journals, from orthopedic to medical to chiropractic journals, will tell you the knee is a slave to the hip and the ankle. So in addition to the knee, you want to make sure the hip and the ankle are also biomechanically stable. Now, in addition to the hamstring, loosening it up, we're going to work on the calf muscle here. Now the calf muscle is comprised of two muscles. You have the longer one right here, and then you have the meaty muscle that comes in right there. So we want to make sure both of those are released and loosened up for us to do our second half of treatment. Perfect. Now, here comes the bread and butter of what we do here in our office and what I do as a sports rehabilitation doctor. This is my tool. This is actually instrument assisted soft tissue mobilization, IASTM, or better known as Grafton technique. It is a beveled edge, and what we do is we go in and release the tension tissue that's in that knee that's not allowing Dr. Smith to get that full range of motion. So we put a little lotion on it, and we're going to go in and we're going to have him bend his knee slightly, and we come in through here, and I know he's going to feel this right in there. Yeah. What we feel is almost like a speed bump. That's why I tell patients, you're almost feeling like a speed bump. That's the adhesions in that fascia or the webbing around your muscles and tendons. We're getting that release. Now we do it medially, and now we're going to do the outside portion of the knee. This is where he's got the big time trouble right there. You see the deep breaths he's taking right here? This is a little tough.
Oh boy.
Yeah, buddy. We come at it from different angles. Get in there. Really get that release.
Oh boy.
Good. You can do this two ways. You can do it as I'm doing, holding the patient like this statically, and then what I like to do is progress my patients through dynamic, where I'll actually do this technique while they're doing whatever exercise gives them the most pain, whether it's getting into a sprint position, squatting, doing a jump like in basketball. We can actually work on patients on the court, on the field, whatever it may be, to help our patients get better. You notice a little bit of redness there? That's not a bad thing. The redness there is actually blood rushing to the area to help heal the tissue in the right way. We're actually helping it kind of heal in the right way. All right, Dr. Smith, come on up for me. Go ahead and walk around a little bit. Tell me how that knee's feeling.
There's definitely less pressure. So yeah, it's easier to do the range of motion I need to. Less tension when I'm, stretching out the hamstring here. So, as for, he worked on the popliteus as well as he worked around the gastrocnemius and into the soleus. So the soleus muscle is activated when you actually bend the knee. So that's feeling a lot better. And I feel like with all the working that I've been doing at the desk lately, sitting in that seated position, that's probably what it is. So I appreciate you hitting all those points. Is there any other things that you would suggest that they can do at home, or should they just come in and get an assessment from you?
Well, absolutely, assessment, you want to get a full thing, but especially if you've injured the back of the knee, the biggest question I get is heat or ice. You really want to kind of go toward the ice. You want to try to ice the area because heat can actually aggravate and anger the joints and the nerves that are in that area. So if you have an ice pack, put it inside of a t-shirt, put it on that knee. 10 to 15 minutes is all you need just to kind of subdue the inflammation a little bit. But without getting into it, you really want to get fully assessed by a medical professional before doing anything.
Sounds great. So if you got some knee issues going on, check out Shin Wellness, Dr. Sam Rassoul, and we'll see you on the next video.